Good evening, guys. Good evening. Welcome to session 2 of the Ayurvedic Self-Care Challenge. I hope everyone's had a fantastic day. I hope everyone's had a really good, happy, healthy day today. Had some seriously motivating and inspiring and very quite emotional messages and posts about this morning. So, it's always what we spoke about yesterday is always challenging in a way because getting up earlier isn't always easy. It can be quite difficult initially, but so many people, dozens and dozens and dozens and dozens of people said they set their alarm, they woke up half hour early or an hour early, and they said, watching the morning sky, the birds, the peace and quiet, and experiencing that quality that you can only get at that time of the day. That's obviously an emotional response, but knowing that is activating and entraining the optimal functioning of every single cell in our body, including our genes, in the direction of health is such an empowering thought. So a massive well done to everyone who had a crack at that and got up a bit earlier. And if you're thinking about doing it, please give it a go because those morning clock genes, what we spoke about yesterday, really is a pillar, a bedrock of what it is to experience optimal health, optimal vitality, optimal immunity, mood, disease, resistance, etc., etc. Before I dive in, as I said yesterday, if everyone could just give me a barrage, a flurry of emojis, just to help everyone who's trying to find the video on the Facebook page. It just helps bump it up to the top so everyone can find it a little bit more easily. So if you could just give me an absolute barrage of smiley faces, thumbs up, whatever emoji you want, just to help get this to the top of the post, the page so everyone can see it. Again, a massive thank you as well for all of the interaction on the Facebook page today, above and beyond this morning's posts around the morning, the sunrise and the dawn era and the dawn period. We had loads of comments, loads of questions, and that's what we want to see. Because if you're asking questions, then it shows that we're trying to work out how do we apply this to us. Is this good for me? I'm fasting, I exercise, then I do this, that, and the other. How does it fit me? Because that's the aim of this Facebook group. It allows us to answer questions. It allows us to make sure that any potential barriers to what we're talking about can be removed so that you can embed them into your life in the way that fits you as an individual. Because what we've got to remember with everything we'll be talking about this week, including what we're talking about today, this has to fit you. Okay, if we become a slave to it and we force ourselves to fit it, then it can often cause more friction than it solves. Okay, so we have to make this very effortless and fluid. Okay, so if you've got any questions, anything you want clarity over around how this applies to you, then like I say, just please let me know on the Facebook page. So today, moving on to our second Ayurvedic health ritual. Okay, the first ritual was yesterday's content, which was restorative rhythms and circadian medicine. Today, our second ritual, okay, which is the almost Ayurvedically speaking, kind of mandatory impact of something called self-abhyanga or self-massage. Okay, and in the Ayurvedic traditions, it's one of the pillars of self-care. Okay, in the same way that eating healthy food is, in the same way that meditation is, self-massage is it's kind of just a foundational practice to unleash the benefits of Ayurveda. Okay, and it's so abhyanga. Okay, so we call it self-massage as the closest, I guess, Western translation, but actually abhyanga. Yet the Sanskrit word, the conceptual translation is love with oil. Okay, love with oil. And obviously there's always a risk that's going to get misconstrued. But it's a subtle message, but it's an important one because love with oil, that's how self-massage is viewed in the context of Ayurveda. Because when we massage our bodies, okay, and that's what all the self-massage is. It's a very short massage we perform on ourselves every day. The impact of doing it, and I'll talk about them in a minute, are mind-blowing in terms of our health. But it's an act of self-care. It's an act of love we do to ourselves. Okay. And it's something that I was, taught and exposed to from quite a young age. And obviously, when you're in your teenage years, you lose some of these practices and some of these these concepts. But as when I moved into adulthood, I've embedded it, and I've done it for many years, decades actually. And I would be lying if I said that I do it every day. Okay, I probably use self-massage. I try and do it every weekday. So I do it at least, 5 days a week. And I can unequivocally tell the difference between the days that I do it and the days that I don't do it. Okay, and the evidence supports why that would be the case. But just, anecdotally, individually, I feel, when I don't do it, I feel more scattered. I don't feel so grounded. I don't feel so balanced. I don't feel so energized. I don't feel so positive in my emotional outlook. Okay, I don't feel the best version of myself. And then it will dawn on me that I haven't done it today for whatever reason. And the next day I will do it, and all of those qualities will come back. Okay, it makes you feel, paradoxically, you feel calm, you feel centered, you feel grounded, but you also feel very energized, very empowered, very strong, very positive. And there's very powerful clinical evidence to support why massaging the skin would have that impact upon our, on our body and mind. Okay. So I want to talk about what the benefits of self-massage are, evidentially. I want to talk about, how it works, because knowing what it does is one thing. But if we actually understand the A plus B equals C, if we understand how the stimulation of the skin is able to induce such profound impacts upon our physiology, our psychology, our hormones, our immunity, etc., we're a lot more likely to kind of comply with it because of the robustness of the evidence. Okay, so firstly, the benefits. Okay, and what's really interesting is self-massage is rapidly entering into the mainstream medical model. Okay, it's very much entering conventional medicine, conventional care, and anything that enters medicine from the outside always does so through the door of research. Okay, there has to be research to show that if we do this, we get this benefit. And I want to talk about one study, okay, that I think is perhaps the most succinct way of me articulating how profound this is, okay? And I went to a conference up in Newcastle many years ago, and it was a presentation of a cardiac inpatient study, okay? It was Liverpool, Manchester, and Newcastle medical school, hospitals. And what they did, they wanted to understand what impact self-massage could have on the health of people who were inpatients for cardiovascular problems. Okay, so the only criteria was that you were alive and you were admitted as a patient in a hospital for cardiovascular reasons. So you had to be on a cardiovascular ward. That was it. Okay, they then randomized that, hundreds and hundreds and hundreds of people, men, women, older, younger. They randomized them. 50% got normal care, all the care, the brilliant care that you would get in those hospitals for whatever problem they were suffering from. Okay, the other 50% got exactly the same care, okay, standard care, but they were instructed on a ward-by-ward basis by a nurse how to perform a 5-minute self-massage. And then they were asked to do that every day whilst they were in hospital, okay? And that was it. And they were followed up. And the results are mind-bending, clinically, economically. So what happened? The individuals who performed the self-massage for 5 minutes every day, they left hospital, on average 3 to 4 days sooner, which is obviously massive if you've ever been in hospital. They had less medicine usage, less GP appointments, less complications, and less readmittance into hospital over the next 12 months. Imagine the implications on that on a human level. You're in a hospital, you're an inpatient in a cardiovascular ward, bad sleep, bad food, noisy. You can get out of hospital 4 days earlier. You have less medicine usage, so less side effects, less complications. You go home sooner. You have less GP appointments. You have less complications. You have less side effects. You have a significantly reduced chance of being readmitted into hospital, all through something as simple as 5 minutes self-massage. That's just one study. I could talk about dozens of studies, okay? And that study was the real catalyst for researchers to sit up and say, well, Ayurvedic medicine and traditional Chinese medicine and Tibetan medicine have been advocating this practice for thousands of years. We've now got a solid foundation of evidence to show how profound it can be in a Western model. Shouldn't we really start researching this and actually trying to understand it? Because in terms of gain for effort, it might just be the most powerful self-care practice of them all. Because yesterday I spoke about how the whole of global medicine is putting self-care at the center of healthcare. It has to. It's the only way out of the pandemic problems that we discussed yesterday. Okay, but the whole self-care movement is based upon gain for effort. What's the maximum gain you can get for the least amount of time and effort? Okay, if we've got to massage ourselves for 2 hours a day, or meditate for 3 hours a day, or exercise for 4 hours a day, it's never going to work because it's never going to be sustainable. No one in normal life can commit to that period of time. So with self-care, what we're looking for is maximum evidence-based gain for minimum effort. And if we apply that criteria to self-massage, it comes out top, okay? Because meditation, you typically need 12 to 15 minutes to get a dose response. Okay, exercise, you need 10, 15 minutes, even if it's high intensity. But self-massage, you're looking at 3 to 5 minutes for a clinical gain. Okay, which puts it at the top of the tree for gain for effort. Okay, and what is the current state of play? So I actually wrote down before I came live just now. I wrote down the current state of play around the clinically proven impacts of skin stimulation, what we would call, self-massage. I'm just going to read them out, okay, because it's a who's who. So, performing regular self-massage is now clinically proven to increase immunity, reduce inflammation, reduce stress hormones, alleviate anxiety, increase physical energy and vitality, reduce fatigue, improve mood, increase metabolism and weight loss, lower blood pressure and heart rate, reduce headache prevalence, increase hormonal balance, stimulate immunity, reduce infection rates, and possibly linked to reduced risks of chronic diseases like cancers, heart disease, etc., etc. Obviously, we're not going to go through each and every one of those in detail, but that is unimaginable. Think about everything I've just said there. Just the first two, increasing immunity and lowering inflammation. Okay, it's hard to emphasize the significance of that because virtually every disease we'll ever suffer from, and every disease that is going to kill us, has their foundation in immune dysfunction and chronic inflammation. Okay, every single disease in the book, the foundation of that disease is simmering inflammation. That cancer, Alzheimer's, heart disease, strokes, all of it. Okay, immune dysfunction, poor immunity. As we age, our immune system always drops significantly with every passing year after the age of about 48, unless we do things to mitigate that. Okay, so in terms of aging well, in terms of aging, with vitality and health, with maximizing our ability to prevent infection, staying youthful and strong and happy and positive and balanced, and your hormone balance. Okay, these are hugely important things, and we're getting it from something as simple as 3 to 5 minutes of self-massage. How? Okay, how can this create the kind of responses we saw with the cardiac inpatient study? How can it induce these kinds of benefits that I've just listed? Okay, so what the research said was, okay, well, if these gains are that profound, we need to understand how it's facilitating them. So what we now know, and Ayurveda obviously didn't know this, okay, going back, self-massage, self-abhyanga has been used in Ayurveda for over 4,000 years as a pillar of self-care. But what it didn't know, it knew it worked, but it didn't know how it worked because there wasn't, blood analyses and MRIs and things like that. Fast forward to the 21st century today, what do we know? We now know that the stimulation of skin, okay, is the single most powerful tool we have for regulating our endocrine system, our hormones, okay? More than anything else, more than our pituitary gland, our adrenals, our hypothalamus, more than any other, our thyroid, our thymus, more than any other gland or organ in the body, the most effective tool we have for modulating, controlling, balancing our hormones is the stimulation of our skin. Okay, why? Because what skin stimulation does is it moves our hormone status from a place of stress response into a place of relaxation response. Okay, so going into that in a bit more detail, we have something called our sympathetic nervous system, which is our fight or flight response. Okay, which causes immune suppression and chronic inflammation and hormone imbalances and this, that, and the other. Okay, that's our stress response. The parasympathetic nervous system is our relax, rest, heal, and digest mode. When we are in parasympathetic nervous system overdrive, we are healing, we're recovering, we're balancing, we're remedying trauma and injury, we're identifying cancer cells and bacteria and viruses. PNS, parasympathetic nervous system, is where we are at our strongest, our healthiest, our happiest. Okay, and just 3 to 4 to even 5 minutes of self-massage will almost unequivocally, without exception, move you from a place of stress response into a place of relaxation response. And we know that commonsensically. Why do we hug people when they're sad? Why do we cuddle people? Okay, why do we stroke the skin of, why, if a child can't sleep, we rub their back? Why do we hold hands with people we love? All of these things, it's the skin stimulation. If someone is sad and you hug them and cuddle them, it helps alleviate that distress. Okay, and some of the most extreme examples of this are children who newborn babies who die very soon after being born. Okay, and it's obviously horrific, but there's a growing foundation of research, and I'm sure people have read about this in the newspaper. It's actually it's an area of scientific research. So a baby is born, there's some kind of issue, and it dies within the first hour or so. Okay, and then the parents are obviously unimaginably we can't imagine what that would be like. And what happens? Sometimes the mum will hold on to the baby, skin on skin, and will stroke that dead child for hours in some cases. Okay, in some cases it's been kind of 8 hours, and then at some point in that period, the baby that's been declared dead takes a huge gasp of air, and it's a reflex, and it's enough to restart the system. And it's not common, but it's common enough to understand how do these children that are medically dead, these newborn babies, come back to life. And the only two things that are clinically predictive of that: one, the mum and the baby need to be skin on skin, and there has to be stroking. It's never ever happened without stroking the skin of the dead child. Okay, and the theory is that in a body that's so recently dead, where it's still there's no necrosis, it hasn't deteriorated, the stimulation of the skin is enough to jolt the hormone system into a survival response that causes a gasp of air that sends oxygen into the brain, and it restarts the system. Okay, and that, whilst that's extreme, shows how unimaginably powerful the stimulation of our skin is. Okay, we know that it feels nice. If we're sitting on the sofa with our loved one and they start rubbing our arm or massaging our foot, it feels good. The reason it feels good is because it's changing our hormones. Okay, so there's also another mechanism. So the main mechanism by which self-massage can impart these gains is through the stimulation of our skin and the hormone changes that induces. Okay, but there's another mechanism, and it's typically Ayurvedic, because what Ayurveda does is that most things it employs, it has kind of a foundational response, which is the stimulation of the skin, but it has kind of the cherry on the cake. Okay, and the cherry on the cake in the context of self-massage are called medicated herbal oils. Okay, and they are a secret almost of Ayurveda. It fascinates me that they haven't gained the traction in the West or in Europe that they have in Australia and America, particularly where they're much more common. Because what Ayurveda has is a handful of ancient, time-tested and now researched herbal oils. And by a herbal oil, what they do, they have a carrier oil like sesame oil, coconut oil, almond oil, huge vats, kind of 6-foot vats. They put a load of oil into the vat, and they put loads of herbs for whatever oil they're making, different herbs. And that macerates down until after about 4 weeks, the oil is strained, the herbs are strained away, and you're left with a super concentrated medicated oil. Okay, and you have oils for immunity, you have hormones for oils for female health, for fatigue, for pain, for skin problems, for insomnia, for poor immunity, and on and on and on. Okay, and these are a treasure trove. And what happens when you massage the body with those oils, you get all of the benefits of the skin stimulation. But then what happens to the medicated oil? It uses something called transdermal therapy. Think about how HRT patches work, how do morphine patches work, how do nicotine patches work. They deliver medicated compounds through the skin into the capillaries. Once they're in the capillaries, they travel around the whole body and work. So if we are massaging our body with a medicated oil that we're using to support immunity or reduce menopausal symptoms or lower PMS or reduce pain, we're getting all of the benefits of skin stimulation, and then we are exploding those, extrapolating those even to even bigger gains by using a medicated oil that specifically targets what we're trying to achieve. And when we had our big full-time clinic, we used and prescribed these oils for self-massage to our patients, hundreds of times a week. And the feedback is, over 15 years, I've seen it have a life-changing impact. And suddenly we get all of the benefits of self-massage and a kind of like a double benefit through using the oils. I don't want to, I was trying to work out whether I could talk about the oils tonight, but I think it's going to be too tight for time. So what I'll do, I'm going to post up a document, okay, that comes from the Ayurvedic Mentor, which is my membership platform. I'll talk about that later in the week. But on there, we've got, just a ridiculously large volume of resources. And we're going to share the overview of kind of the primary 4 or 5 medicated oils. Okay, so you can work out what ones potentially are best for you. And then obviously you can ask me questions, and I might do a live Q&A or a short live session about them later in the week. Okay, but the big thing to emphasize is that you don't need to use a medicated herbal oil. Okay, to harness all of the benefits we've just spoken about, you don't need to buy a specific Ayurvedic herbal oil. Okay, you could just use, I'll talk about how to perform a self-massage first. Okay, so the first thing is the oil. So you could use, sesame oil, which you can get from any health food shop. You could get almond oil. You could use extra virgin olive oil. You could use extra virgin coconut oil. Okay, it needs to be a pure oil. Okay, Ayurveda has this beautiful saying, which if you wouldn't put it in your mouth, you shouldn't put it on your skin, okay? Because it ends up in the same place, like I just said. Whatever you put on your skin will end up in your blood, okay? So it needs to be a pure, natural, cold-pressed, unheated, unadulterated oil, okay? I like extra virgin olive oil. I like sesame oil, okay? For me personally, I use an oil called Maharanan oil, which is one of the medicated oils, because it fits my kind of body type and my for me as an individual, it's the best one for me. But if I didn't have that, or I didn't know about that medicated oil, I would use sesame oil or extra virgin olive oil and coconut oil in the summer. Okay, coconut oil is very cold, so if you suffer with things like hot flushes, night sweats, irritability, what we would call pitta problems, so any kind of anger, hotness, sweatiness, coconut oil would be the best option. Okay. In terms of how you perform it, okay, you want to use oil warm, really. You don't want to be applying cold oil to your skin, and you can warm the oil in a complicated way or a very simple way, a more ritualistic way or a kind of pragmatic way. So the more ritualistic way, which is beautiful to do, is just to get a little oil burner with a little tea light. So you just light the tea light, you put the little bowl on top of the stand, you pour your oil in, and then a couple of minutes later, it's nice and warm. Okay, that's you've got the candle light, it's very ritualistic, it's a beautiful practice. Or you could just leave the jar in the sink of warm water, or even take it in the shower with you. It doesn't need to be hot, it just needs to be warm. Okay, and then we don't need to lather ourselves in it. Okay, the amount of oil we're using should be enough so that there's not any friction, but not so much that it's dripping off. Okay, we don't want it shouldn't be pouring off of us. Okay, You can do it before, classically in Ayurveda, it's done before you shower, or you can do it after you shower. Okay, personally speaking, I like doing it after I shower because it leaves more of the oil on. So I have a hot shower, all the pores open up. I use the self-massage for kind of 4 or 5 minutes, and I just pat down with a towel and I'm ready to get dressed. Okay, so you can do it before or after. But there's a couple of key points to be aware of in terms of how you perform it. So personally, I'm very against manualizing how you perform a self-massage, because the best way of performing it is to listen to your body. What feels good? Okay, things like stroke speed. You prefer a really fast, more invigorating stroke, or a slower, more calming, grounding stroke. If you're really tired and fatigued and lacking energy, a faster stroke is going to be more invigorating. It's going to wake you up. If you're feeling really stressed and anxious and overwhelmed, a very slow, calming stroke is going to help. Okay, do you apply a lot of pressure or just superficial pressure? Okay, but what is helpful and a really important aid memoir is over your long bones, so your lower arm, your upper arm, your lower leg, your upper leg. It's really good to do long flowing strokes over the long bones. Okay, but when you get to a joint, shoulder, knee, elbow, hips, do circular joints. Okay, you don't want to really be doing flowing long strokes over the joints. Okay, so long bones, long strokes, joints, circles. Okay, the other thing is you always want to kind of be going to the heart. Okay, there's a bit of the jury is still out here. In classical Ayurveda, you typically work down. Okay, but I think with the lymphatic system personally, and way I was taught by the Ayurvedic kind of masters that I worked under, who are 7th lineage, is to work up. So I start at the foot and work up one leg, where they work up the other leg, then the abdomen, then the arms, then the shoulders, and then the neck. Okay, and not all parts of the body are created equal. Think about where we hold tension. Our shoulders, our trapezoids, the back of the neck, and even our face. So we've got, Ayurvedic facelift. Okay, so there's those of you who are in the Ayurvedic Mentor, check out the face yoga series. The whole series about how we stretch and massage our face to reverse aging. But we can simplify it. Just really windscreen wiper strokes under our eyes, over our eyelids, across the jawline. Okay, we know it increases skin elasticity. We know it increases blood flow and muscle tone. It can have a really powerful anti-aging effect. Okay, so you want the massage to last no less than 3 minutes, but you can make it last more than 5 minutes. But if you do it for 3, 4, 5 minutes, you're going to get the gains we've just spoken about. And for most people, I think most people can find, they take an average 4 minutes. Okay, and the thing that I think is absolutely important is to bolt it on. The biggest thing I've seen that it allows people to start this practice and comply with it long term is that if you've got to bolt it onto something you already do. I say for me, I always do it after I shower. Okay, so we have the oils, Holly and I, we have the oil in the bathroom. Okay, because I know if I go out of the bathroom, the kids are going to jump on me, I'm going to get sucked into this, that, and the other, and the moment's gone. Whereas if I have my shower and everything's there, then I'm already in there. So for me, the shower and the massage are one. Okay, and it's the same way, no one here has to set an alarm or set a reminder to brush our teeth. No one here has to put a post-it on the mirror and say, before I leave the house, brush my teeth. Okay, why don't we have to do that? Because it's habitual. We have the neural pathway in our brain. It becomes a habit. We don't have to think about it. We want self-massage to become that, in that whenever we jump in the shower, it's just a reflex that we do a massage before or after. Okay, if we can do that for about 3 weeks, the evidence shows it becomes an embedded habit, and then we'll kind of do it for life. You haven't got to do it every day, like I say. Even if you did it every other day to start off with, 1 day on, 1 day off, 1 day on, until you work out, what works for you. Okay. The other thing I'll upload onto the Facebook page a written guide for how to perform a self-massage. Okay, just so you haven't got to refer back to this video if you're trying to remember how to do it. So it's just a short A4 document that talks about kind of the steps of how to do it. Okay, which again, that comes from the Ayurvedic Mentor. So think about that cardiac inpatient study. Think about that list of benefits I spoke about. Think about how it transforms the physiology of our body in the direction of health, have a profound impact upon mood. Dopamine, serotonin, cortisol, it has a hugely uplifting effect upon our psychological and emotional health, okay? So what ultimately this is a 4 or 5 minute practice that impacts upon virtually every part of who you are, but in a discernible way. These are gains that you will experience. You will feel it in your energy, you'll feel it in your mood, you'll feel it in your how calm and grounded you are. If you've ever done yoga or meditation, think about what you feel like after that. That's what you feel like once you start embedding self-massage, okay? Within Ayurveda, it's sacrosanct. So your challenge tomorrow is to, one, try and maybe get up a little bit earlier to harness those morning clock genes, to entrain with your circadian rhythm. And then at some point in the day, you might do it in the evening, okay? It hasn't got to be in the morning. You might do it in the evening. At some point tomorrow, try and experiment with performing a self-massage on yourself and work out what you like. How much oil, what temperature of oil, how much pressure, how fast. Just experiment with what feels right for you. And then just commit to trying to do it every day. Okay, even if you just do it for 2 minutes and then build up, because if you can do it every day, you'll set the habit. And if you set the habit, you will unleash all of these benefits. And they're not small benefits, they're transformative benefits. Okay, which is why Ayurveda's advocated it for the last 4,000 years. Okay, so it's essential. It's a key part of Ayurveda. The Western evidence is robust. It's something we experience. It's discernible. It's a win-win for 4 minutes of time. Everyone's got 4 minutes. Okay, so any questions? Again, I can see loads of questions popping up. Like I said yesterday, I'm not ignoring the questions. I'll answer them retrospectively just so we don't overrun too much. Okay, so everyone who's asked questions, thank you very much. Again, a massive thank you to everyone being here live. To have 70, 80 people here live is an absolute privilege. So huge thank you. Again, keep the energy high in the Facebook group. Share your comments, share your photos, share what you're eating. Anything you want answered, use the Facebook page. Let's inspire everyone as we continue this journey. And I will be back tomorrow evening for our 3rd session. But like I say, I'll be active on the Facebook page. So any questions, let me know. But other than that, have a lovely, lovely, lovely evening. Commit to self-massaging tomorrow. Let me know how you get on. And then we'll go from there. Cheers, guys. Take care.